All right. Welcome, everybody. I really appreciate you being here today for a discussion about drug-resistant epilepsy and about the vagus nerve stimulator specifically. My apologies if you see me looking up or down. I had a little audio issue here in my office, and so I'm using my phone for the audio, so my apologies if you see me looking in other places. But I'm Dr. Polovitz. Very nice to have you here today on the Epilepsy Awareness Day at Disneyland. And I really appreciate you joining to talk about drug-resistant epilepsy and the options that we have for individuals with drug-resistant epilepsy. There's going to be a number of things that we cover today, but really importantly, I want to make sure that your questions are answered. So feel free to ask questions in your chat box at any time. And I like to make this as interactive as possible. This is your time. I'm here to help answer any questions that you might have, and also to talk about drug-resistant epilepsy and specifically about the vagus nerve stimulator. My name is Katie Polovitz. I am an adult epileptologist, and anybody who's new to epilepsy, what an epileptologist is a neurologist who specializes in seizures. I'm out here in the Denver metro area. Most of my clinic, I work with individuals with epilepsy. Okay, one sec. I think my screen share here is just slightly delayed. Let's see if that'll go. There we go. So today we're going to discuss, we're going to talk about drug-resistant epilepsy. And if that's a new word for you, don't worry. That's a lot of people that I meet have never heard of that, even though it's the second most common outcome in epilepsy. So we're going to really discuss drug-resistant epilepsy and what that means. Then we're going to talk about specifically what are the chances just with medicines alone of becoming seizure-free. We're going to talk about an option for individuals who have drug-resistant epilepsy, and that's called the vagus nerve stimulator. It's a stimulator that's been around, that's not a brain surgery. It's been around since 1997. There have been improvements in the technology, especially a big improvement in 2015. So we're going to talk about that during the course of this presentation. And I most importantly want to take the opportunity to answer any of your questions that you have during the presentation or at the end. And also give you some more resources. If you think that this is a great option for you, there will be resources that I will provide for you so that you can find out more information. All right, so I've been alluding to it, but you guys, what is drug-resistant epilepsy? Well, I think in order to talk about drug-resistant epilepsy, anybody who's advocating for their care today on this call, learning more about what you can be doing with your condition, the first thing you should know is that epilepsy is extremely common. We do not talk about it enough, but epilepsy affects 1 in 26 people in the United States in their lifetime. 1 in 26. It's one of the most common neurologic conditions, and 1 in 10 people will have a seizure in their lifetime. But we just don't talk about it enough. So if you're somebody who's newly diagnosed with epilepsy and you're learning more about it, first of all, so happy to have you here. And second of all, you are not alone. Epilepsy is extraordinarily common, and we as a society need to do a much better job of talking about it. This has been throughout the years and still today. Now, things like Epilepsy Awareness Day at Disneyland is one of the ways that we are talking about epilepsy and getting the awareness out. So again, thank you for being here today. If you are new to the epilepsy community, please know that we are working as hard as we can to advocate, to learn more about epilepsy, and you are not alone. 1 in 26 people will develop epilepsy in their lifetime in the United States. Okay, so you have epilepsy. What happens next? Well, you go see your provider. We try different medicines, but what if your medicines aren't making your seizures stop, right? Are you one of those individuals where you've tried medications and seizures aren't stopping? Well, that's the second most common outcome in epilepsy. The most common thing that happens when you develop seizures in epilepsy is that the first medication, about 50% of people, the first medicine stops the seizures. But if you're somebody and you're thinking, well, I've tried this medicine, this medicine, this medicine, and this medicine, and my seizures are still happening, please know you are not alone. The second most common outcome in epilepsy is that you have drug-resistant epilepsy. What that means is the failure of two medications, one and then another, or two together, the failure of that to stop your seizures. And if you're feeling like you're the only person, you're not. It is the second most common outcome in epilepsy, and it's 1 out of 3 people with epilepsy develops drug-resistant epilepsy. So in context, there are currently at least 3.4 million people in the United States with epilepsy. Over 1 million of those individuals, the medications alone are not getting the job done. So it's really important that if you're feeling frustrated, if you've tried medicines, you've tried 2 medicines at very good doses, or your body just didn't tolerate them, it's really important to know that just doing medicine after medicine is not a good idea, and to consider doing options outside of medicines. So again, the second most common outcome in epilepsy is drug-resistant epilepsy, meaning you've tried 2 medicines at healthy doses, and that seizures didn't stop. So that's the second most common outcome, is that the seizures didn't stop or improve with medication alone. 1 out of 3 people with epilepsy, the second most common outcome. Sorry, I can't say that enough because it's so important to hear. I want you to know you're not alone. It's the second most common outcome in epilepsy. So what do we do? Well, the remainder of my presentation today, outside of getting to any questions that you might have, is to talk about an option for 1 out of 3 people with epilepsy. And for those 1 out of 3 people who develops drug-resistant epilepsy, the vagus nerve stimulator is an outstanding option, and it should be strongly considered. Now, the vagus nerve stimulator is not new technology. It has been around and FDA approved since 1997. So it's been around for quite some time. But there have been little upgrades that have happened to the device throughout the years and will continue to happen. And specifically, we're going to go over a little upgrade that happened with the device in 2015 that has made this a better device. Now, since 1997, you can imagine that quite a few people have been treated with the vagus nerve stimulator, and that is absolutely correct. There have been over 125,000 people who have been treated with the vagus nerve stimulator, and over 33,000 of those individuals are children. And there's one thing that I see in my clinic that's quite phenomenal, and that's, a lot of people don't stay on the same medicine throughout their life. But when we did the studies on the vagus nerve stimulator and continue to do those studies, we see that most individuals, the vast majority of people who get a nerve stimulator, when the battery is up for being replaced, they get it replaced. It means they are doing that, even though it's a minor surgery, they are doing this because this device has been beneficial to living with epilepsy. We're going to really talk about quality of life and living with epilepsy. Now, if you have drug-resistant epilepsy, which we've already discussed is 1 out of 3 people who have epilepsy, develop drug-resistant epilepsy, the failure of 2 medications to stop your seizures, then the vagus nerve stimulator is a great option for you. And you got to look at it as to what your goals are. And if your goals are to make your seizures shorter, less severe, or less frequent, have improved mood, improved attention and concentration, and overall improved quality of life, it's absolutely something you should consider. Please know that you're going to hear about other options for drug-resistant epilepsy, and they are incredible options too. So doing one of these options does not mean you can never do another option. These are incredibly good options that are frequently used together. But when somebody is 1 out of 3 people with epilepsy who has drug-resistant epilepsy, and if we just keep doing medicine after medicine after medicine, that is not the correct answer. So doing anything outside of the medicines is absolutely the right step. And we're going to talk about the vagus nerve stimulator. So talk to your provider if you are interested in this. So, if you're one of these individuals, this would be a good thing to really strongly consider. So if you're still having seizures despite trying 2 medications, right? Because we've already talked that that means drug-resistant epilepsy. The medicines alone are not improving the seizures. You want to try something outside of just medicines to gain control of your seizures. We're going to talk about one feature of this device that provides on-demand stimulation should you feel a seizure, or more commonly, because not everybody feels their seizures, the vast majority don't. So more commonly, somebody sees you having a seizure, or you think you may have just had a seizure and you want your recovery time to improve. There's a little on-demand stimulation aspect of the device called the magnet. Very cool stuff. It's an added benefit, but it's absolutely not necessary to use. It's just an absolute benefit. If you are, like most people I see in my clinic, where you're taking your medicines, but the side effects are really having a hard go for you, then this device does not have the same kind of side effects as the other kinds of medicines that you're trying. Again, I said, if it takes time to recover from your seizures. So we do know that use of this device does make your recovery time better. And also the use of the magnet after a seizure can be helpful in that recovery time as well. So it gives you something that you could be doing. It gives you some control back. Also, this is probably one of the coolest benefits of any device, and specifically the vagus nerve stimulator. You can't not take it. And the last I checked, it's really hard to remember to take medicines. And so you don't have to remember to take your vagus nerve stimulator. It's built in. So it's not like a medicine where you have to set your alarm and, oh goodness, did I forget to take it? All of those things. You are always doing medication along with the vagus nerve stimulator, other than outliers. But this one, you can't forget to take it. And that is a massive benefit. So the vagus nerve stimulator, over the years that we've had to study it, because remember, since 1997, and even before that, we've been studying this a whole lot. And we know that the benefits are far more than just seizure control benefits. So yes, we know over time, the vast majority of people have shorter seizures, less frequent seizures, less severe seizures, and improved recovery time. So after a seizure. But that's not where the benefits end. We know that getting a vagus nerve stimulator actually makes people have to go to the ER less. It makes people have to be admitted to the hospital less for their seizures. It makes people have less injuries from their seizures and less hospitalizations from injuries with seizures. And then less chance of what's called status epilepticus, which is just fancy doctor speak for continuous seizures. And we absolutely want to keep people away from anything like that. This is a serious topic, but it also helps to keep people around. This device can be life-saving. We know that for the vast majority of individuals with epilepsy, the concern for sudden unexpected death in epilepsy that we call SUDEP, we know that that concern is low. We know it's only about 1 in 1,000 people. But when we have drug-resistant epilepsy, which is again 1 out of 3 people with epilepsy, that risk goes up. And so just doing medicine after medicine is not the right answer. It will actually have a more substantial risk associated with sudden unexpected death in epilepsy. And we know every device or surgery option helps to lower the risk of SUDEP. The vagus nerve stimulator has been the most studied of these device options, and we know it absolutely decreases the risk of SUDEP. We know that people have improvements in their quality of life. Now, your doctor or your provider can sit across the table from you and say, oh, this can help with seizures and make them less severe and less frequent. But unless we have epilepsy, and even if we do have epilepsy, we don't know what it's like to be you. And so no 2 people are the same. And that means no 2 people have the same goals for what it is that makes them live their best life. But we do know that when we've looked at this device in individuals who have it, they report improvements in their quality of life. And we're going to go over that in much more detail. The seizure intensity can improve and typically does with this device, as well as the recovery after seizures, like we talked about. And again, you don't have the same side effects. It's not making you feel dizzy or wonky, not able to focus or sleepy or those things like we can see with the medications. And it's important to know that it can be used with other device or surgical options for epilepsy, as well as medications. Very important for you to know, and you're already doing it by being on this call, that learning about the options that are out there for you is so important. And that just going down one road, picking one option, does not mean that you can never do any other options. These can be done. They're mutually exclusive. Going down one road does not mean you can never go down another. And frequently in my clinic, we multiple epilepsy. If this device would be a good device for you, if any of these things that you see on the screen are compelling to you, this is absolutely something you should consider. So we actually looked at individuals, not just, the doctor saying it to you. We looked at individuals who had this device implanted. This is a study of it's almost 12 the device implanted. And what you don't see is, number of seizures on there, because they were looking at the quality of life things outside of seizures. Now there is this seizure cluster. That means seizures that kind of continue on each other. All these improvements. We saw, over a third of people with an improvement in memory, achievements, verbal skills, mood, like not having so many little aftershock seizures. So not those same seizure clusters. So when you have a seizure, you didn't have multiple afterwards. The post-ictal period, that's just fancy doctors speak for after a seizure period of time. So instead of having a seizure and, feeling tired for, hours or days thereafter, that recovery improves with this device, as well as alertness. And the last time I checked, the medicines that I prescribe in my clinic, that's where I am right here today, I do know that they don't help with people's alertness, but I do know that this device can help with alertness. Now, looking at all of those things right there, we know that the number one thing that can help with somebody's quality of life when they have epilepsy, the number one thing, well, we actually did this study to try to figure out what is the number one thing that help improve somebody's quality. How do I live with this condition the best I can? So we looked at a number of things. We looked at their age, their number of medicines, their type of seizures, where the seizures were coming from, their job status, their achievements, their mood. We looked at all of these things. The number one predictor of an improved quality of life with epilepsy was improvement in depression, having the depression well managed. So if you're somebody who has epilepsy and you feel like you have depression, you are not alone. Over 1 in 2 people, over 50% of people with epilepsy also have depression. So this device, even without having epilepsy, has been approved for depression. For individuals who have depression and they've seen their doctor and they've tried multiple medicines and their depression's not getting better, this device has been FDA approved for treatment-resistant depression. Well, when over 50% of people with epilepsy also have depression, and then last time you probably went to go see your provider and you were doing a medicine and we were saying things like, well, this could make your mood worse. Let us know if you're feeling icky on it. Well, this device is not one that I have to tell people it's going to make your mood worse. It is not. And in the vast majority of cases, there is an improvement. Look at that. I mean, mood changes that for individuals, 49%, and alertness, 63%. That's incredible. And so again, a quality of life parameter, looking at how do I live my best life with epilepsy? The vagus nerve stimulator absolutely does try to promote that. So if you're looking for living your best life with epilepsy, how do I manage my life with this condition? This is a device to consider. All right, so this is outside of my area since I work with adults. But you guys, we know that the vagus nerve stimulator, when it's used for children, is incredibly effective. It's incredibly effective for adults. But think about what a brain is doing when we're a kid. You know, I mean, I would like to think that our brain is changing a whole lot as adults too, and it is, but not like when we're kids. When we are children, or when we were children, our brain, they're like sponges. They're absorbing all this information. We're learning rapidly. But if we're too busy having seizures, we aren't learning. The brain's only doing one or the other at that time. So we know when we have kiddos who have seizures, we've got to get those under as best control as possible because there's critical learning happening. And so it's so important if you are a child on this call, or if you are the parent or loved one of a child, to strongly consider if they have drug-resistant epilepsy, doing anything outside of medicine, and the vagus nerve stimulator being the most studied device, looking at getting those seizures under better control. Because look at these statistics. 63% of the children had fewer seizures in a study, 48% of children with shorter seizures in a study, 42% of children with less severe seizures in a study, and 40% of children with better recovery after seizures, right? Because if you have a seizure at school, and now all of a sudden the whole day is gone, you don't get to go back to learning. But if you have a seizure at school, you use a little magnet swipe and, well, I'm starting to feel better. I'm going to go back to learning. That is crucial. And again, those very important learnings that are happening for those young brains, we know the earlier we intervene and get seizures under better control, the better. Now, seizures, the longer that we have them, the harder they get to treat. So we know that if we have drug-resistant epilepsy, options outside of medicines early is of the absolute utmost importance, regardless of what road you go down. Remember, these are not only going down one road, but the vagus nerve stimulator is the least invasive of the surgical options. And look at all of these improvements, especially in the most important of our brains, those pediatric brains that are growing and learning. And we got to get those seizures under better control. Can't stress that one enough. So important. We need those brains to be learning instead of seizing. So let's look even more into that. So we know that the benefits of the vagus nerve stimulator therapy in children, we know that trying more medicines, we went over that. 1 out of 3 people with epilepsy has drug-resistant epilepsy. So the second most common outcome in epilepsy. So just doing medicine after medicine after medicine is not going to make the seizures improved for the vast majority of cases. But we do know with the vagus nerve stimulator that seizure control continues to improve over time. Children and the adults I see in clinic, over half of them report depression with their epilepsy. The changes that we get in the brain with seizures also affect the changes that we get in the brain with mood. And it's extremely common. And we know that there's quality of life improvements with the vagus nerve stimulator in mood. A lot of children have ADHD, attention deficit hyperactivity disorder. So ADHD is also extremely common, and especially common in children with epilepsy. Well, we know that there are improvements in alertness and concentration with the vagus nerve stimulator. I was just showing you that. And, as an adult doctor, so I take care of adults with epilepsy. Far too frequently, there are individuals who are like, oh man, I was told I was going to outgrow these seizures in childhood, and I'm still having seizures. Why is that, doctor? Well, the reason is 1/3 of kids with epilepsy don't outgrow their seizures. And patients are going to 3 times more likely to become seizure-free if they're treated early on with VNS therapy than if they're treated later with VNS therapy. So like we talked about, it's so important to, if the seizures are not under good control early on in the course of this condition, regardless of if you're an adult or a child, but especially if you're a child, to do any option outside of medicine. And the least invasive device option is the vagus nerve stimulator. So getting to it, let's actually talk about what is VNS therapy. So the vagus nerve stimulator is a device that's implanted in the chest. So it's not a brain surgery. There is a little nerve over here, and I've been saying the nerve over and over. It's the vagus nerve. The vagus nerve on this left side is a little tattletale or a highly gossipy nerve. It goes up to the brain and has lots of different projections where it gets to different areas of the brain. So by stimulating the nerve here, by adding impulses to the nerve, we actually talk to the brain. We do brain surgery. So we've been doing this for years, and we talk about the 3 different lines of defense that the vagus nerve therapy, the stimulation, offers. The vagus stimulator has 3 different lines of defense, the first of which is called the standard. Well, this is all us talking, but all that basically means is that your provider has they program the computer in the chest to say, okay, let's stimulate this nerve in the neck every 5 minutes for 30 seconds. So we set that to stimulate the nerve. We set the computer to stimulate the nerve, and then it just goes off throughout the day. Now, if it's every 5 minutes for 30 seconds, that's only 10% of the day. And the vast majority of times that we program this, we're going to be way, way, way under half of your day with any kind of stimulation. And most often in my clinic, it's only about 10 to about 20% of the day. So the majority of your day, the stimulator is not on. And then when it is on, it's only for short periods of time. And so this first line of defense we set is just telling the computer, stimulate the nerve every such and such a time. And then that's all it does. And we know that the more stimulation over time, the benefit improves over time. So that's called the standard mode. All right. So there's now this new mode, very cool mode that wasn't available before 2015. So we've got the computer in the chest here, but right next to that is the heart. And the heart and the rapid changes in heart rate is actually one of the best ways that we can tell a seizure is happening. Did you know that the heartbeat rapidly changes quickly in over 80% of seizures? It's actually 82% of seizures are associated with a rapid change in heart rate. So we've got this computer hanging out in the chest. They built in this little watchdog on what's going on with the heart. Because if over 80% of seizures have a rapid change in heart rate, this computer seems like a good idea if it can detect that. So actually that's what happened in 2015. Now you don't have to do anything. It just is constantly there. And if it sees a rapid change in heart rate, it gives an extra little stimulation. People usually don't feel these extra stimulations. And there's ways that your provider can change the programming if you do feel the extra stimulations. But this, you guys, has made this a better device. And in a study that was done in the United Kingdom, where it looked at individuals who, didn't have as great of a improvement, say maybe only about, less than half of an improvement in their seizures, they got re-implanted with this new device because, again, they were still wanting to do the device. They were having quality of life benefits. But just strictly speaking about seizures, there was an improvement in those individuals who didn't have as great of a response to their seizures. More than half of them then had a greater than 50% reduction in their seizures. I'm telling you, this new line of defense makes this device a better device than it was in the past. And it was always a good device. It's just better now. So you don't have to do anything for this. It's just sitting in the computer. It's constantly there watching what the heart rate is. And again, with over 80% of seizures, we see a rapid change in heart rate. Now, if you're at home being like, I'm worried that I'm going to get extra stimulations if I'm on the treadmill, or, if you're out in Colorado, if you're climbing a mountain, sure, maybe a few extras, but I'm here to tell you that it's not set that every time your heart rate gets to a certain level, you're going to get an extra stimulation. That's not how it works. It's looking for the percent change in your heart rate. So as I'm excited talking to you guys right now, my heart rate is 63. But maybe if I was to get up and go see my patients this afternoon, heart rate would go up to, or, as I'm talking and getting excited about things, maybe it goes up to like 90. Well, it's constantly sensing what your heart rate is, because nobody's heart rate stays the same. And so it constantly is updating what your heart rate is. And then it's looking for the percent change in your heart rate. If it sees a rapid change, then you get an extra stimulation. Lastly, this next line of defense has been a very valuable one throughout the years. It's hard for me to even describe how valuable it can be. It is not necessary, but it is incredibly beneficial if you use it. That's the magnet mode. And frequently people will wear the magnet on their wrist or like on their belt. And if they feel a seizure happening, they swipe. But did you know that more than half, even in the best case scenario, individuals who swear they feel their seizures, less than half of them got it right when we actually did a test on that. So the magnet actually can be even more powerful for loved ones, for friends, for coworkers. And if somebody sees somebody having a seizure, they swipe the magnet. And in 2/3 of the cases, the seizure either stops or gets an improved, it's shortened, which is incredible. It could be the difference between staying at school and learning that day, staying at work and not having to have a sick day. I've had a number of my patients teach their coworkers how to use the magnet. This is something that in our pediatric patients, so in working with our kiddos, that the school nurses know how to use, that frequently teachers can be taught how to use, and that parents find it incredibly invaluable to use, so that you can be doing something when somebody is having a seizure. So the magnet is a benefit. You see a seizure happening, you feel a seizure happening, you swipe, it provides stimulation in that moment. It's a benefit. It's not necessary to make this device, for this device to work, but it's a benefit. So it brings control back in a pretty control-free situation, and that's what we experience in epilepsy. So getting some control back, something we can do. So this is going over the magnet again here. So let's go over it in a bit more detail. So the magnet itself, it provides an extra dose of the therapy, and it can stop the seizure, it can shorten the seizure, it can decrease the intensity of the seizure, and improve the recovery period. Remember, we talked about that post-EADDL period, or the recovery period after a seizure. And we know that use of the magnet, even if you wake up and you're like, oh, I think I may have had a seizure last night, use of the magnet can improve your recovery time from a seizure. It can make the difference of going home from school that day, or the difference in staying at your job that day. And so the other thing it can do is, if you are somebody who has a little voice change with your device, and you are giving a presentation like I am today, you can actually take the device and put it right over the computer, have it stay there, and it can turn off the device momentarily. So if you got a speech, you're in debate class, if you are going to sing in church, you name it, anything that you're like, I want to turn this device off for a little bit, the magnet helps us do that. You tape it right over the computer in your chest, and it momentarily shuts off the device. And the moment you take that device off, then it starts working again. And again, many people can learn how to use the magnet. Like I said, patients, family members, caregivers, teachers, school nurses. It's just swiping over the computer in the chest, and that's all you have to do. We always say to swipe less than 2 seconds. So I tell people on, off. or if you're somebody who likes to do the 1 Mississippi off, however you want to do it, just not longer than 2 seconds on there, or it can accidentally shut it off for that little period of time. So you'd be surprised, 1 to 2 seconds can last longer than you think. So just one off to add that extra stimulation. Now, it's really important devices and to improve over time. Epilepsy is a condition of the brain's electricity. So it's incredibly important that if your doctor needs to be able to do an MRI, they can do an MRI of your brain. And so this is a MRI compatible device. There are specific areas that there are some extra restrictions, but for the most part, this is an MRI compatible device. So that's really important. Not all devices can go through the MRI machine, and this one absolutely can. Again, there's a couple of additional things to jump through, like you have to have it turned off, but you can still get an MRI, which is really important. Now, with the newest device, it's called the Sentiva. This device actually was made pre-COVID, but it has very COVID-friendly parts to it. So when you get the device, it's not like it works immediately. It's really important to know that it takes time for this to work. I tell my patients not to judge it for at least a year, but I've got other friends who are other providers who usually will say about months. So it's important to know it takes time for it to work. Well, one of those factors is when we program it, we don't immediately go up to the high dose. We have to get your nerve used to the stimulation. So usually you see your provider every 1 to 2 weeks. So you have to go in for frequent appointments to get the device to go up and up and up in dose. And the technology that was developed before COVID is extremely good. Now we can program the computer with the newest model that it will naturally go up in 2 weeks without you having to come into the office to do that programming. So that's pretty cool stuff. And it also has the option of, if somebody is more likely to have seizures, say 3 in the afternoon to 6 in the afternoon, we can change the programming and make it stimulate at a higher intensity or more frequently or both during that time. So now we don't just have one set of programming, we can do 2 separate times of programming, which is very, very cool. So it's really important for all of the technology that comes out that there continues to be improvements. And these were significant improvements that have been coming out since 2015. And the most recent ones that have even more customizable control. So your provider can schedule the programming to happen at home without you having to come in every 1 to 2 weeks. Again, you do have to come into the office to get that first programming done, but then after that, we can actually set up the programming. And if you're somebody who's more likely to have seizures early in the morning or late at night or certain times of the day, or for some reason, you can't have the normal settings at a certain time of the day because of you do such and such at that time of the day, we have ways that we can change the programming, and it makes it an even more responsive device. So this is what I was alluding to, but again, this surgery is not brain surgery. And what you can see on this drawing here is you've got a little computer in the chest, and then see that little string, that's the line that goes up to the vagus nerve. So you've got computer that talks to the nerve in the neck. The typical battery life lasts, 5 to 10 years. I tell people, roughly about 6 are new technology, but I've got a whole lot of people that I see in my clinic that make a liar out of me, and it lasts longer than that. And again, you can have these incredible benefits without a brain surgery. So this is just a little incision here in the neck, and then that line is actually connected to the computer in just it's typically what we call an outpatient procedure, which means usually you don't have to go into the hospital. And so you go to the surgery center that day and you leave the surgery center that day. So that is very cool. So really important, if you're strongly considering this, it's important to know, what are the potential side effects? First and foremost, take a look at my list there. None of those are sleepy or memory concerns or depression. And that's common side effects: sleepy, dizzy, drowsy. Those are the side effects that we're talking about all day long with our medications. So the side effects that the vagus nerve stimulator can have typically improve over time. But when you're stimulating the little nerve here in the neck, right underneath it is a little nerve that goes to the vocal cords. The most common thing that I see is that when it stimulates at first, people's voice can get a little hoarse like that. Again, it's not on the vast majority of the day. So even if you do have that hoarseness, it gets better over time. And it's like the minority of your day, usually about 10 to 20% of the day. Rarely people can have shortness of breath or a sore throat. And then when you're first getting your stimulation, it can make you cough a little bit. Usually that improves within a couple of stimulations, like less than even an hour in my clinic. Again, cannot emphasize enough that if you do have stimulation related side effects, they are not medication related side effects. They are not making you sleepy, dizzy, drowsy, or depressed. They're actually improving all of those things. And if you do have the little hoarseness side effect, it typically does improve over time. And infection itself is an extremely low risk part, but anytime anybody has any surgery, there's always risk of infection, but infection tends to be a very low risk situation for this surgery. So if you want more information about vagus nerve therapy, what can you do? So there, at any time, you can go to vnstherapy.com, or you can go on your screen right now. You want to be able to work with a provider that knows how to program these things. But I go around and I teach the providers how to program them because we've gotten a lot better at programming over time. So we make sure to give people updates on this. Doctors and providers are doing a really good job of doing the right programming. There are incredible case managers and other staff that can help to run through your insurance, right? It's a procedure. And so you want to make sure that your insurance covers it. And then also kind of important to talk with people who also have epilepsy and if they have this. So if you're wondering, oh goodness, I don't know if this is for me, but I want to talk to somebody about it. There are incredible people who have had this before who can tell you about their experience. Why listen to me, the doctor? Listen to the people who actually have epilepsy. So they're called VNS ambassadors. These are people who have done so extremely well with their nerve stimulator that they've decided to advocate, to teach about it so that more people with epilepsy know that it's an option for them. There are community chats. So there are I think it's the first Tuesday and second Wednesday, don't quote me on that. It will be on the VNStherapy.com. But you again are like this, and occasionally I do these talks and do these talks. So they will have that as a opportunity for you. You get to ask your questions, you get to type it in just like you are today. There's also this really cool webinar series that talks about all aspects about epilepsy, like I'm a woman with epilepsy, I'm thinking about getting pregnant, or tell me more about other surgical options for epilepsy, or tell me more about epilepsy and depression. So there's this thing called the Epilepsy Unlocked webinar. Very cool stuff. So those are on vnstherapy.com. You can find out more about all of the options available to you. And then again, your Epilepsy Foundation or the Epilepsy Alliance, also incredible resources. And then you can get more information in your provider's office. Okay, I think with that, if there are any questions, I will take those now. I'm going to wait here for just a little bit just to see if there are any questions. And there is a very lovely individual who has signed into the chat who said, best thing it did for me first was help with my depression. You are so correct. That is wonderful to hear. And that is the thing that I see above and beyond the number one thing that I see in my clinic is that the mood improvements are amazing. It does. We know, since 1997, we have studied how much it helps with seizure severity, the frequency of seizures, and the recovery thereafter. But that mood part, guys, that is huge. So thank you so much for adding that into the chat. I really appreciate your participation, and you are amazing. And thank you for advocating to live your best life with epilepsy. I have a question for an individual who's saying, is it recommended for both partial and complex? Okay, this is a very good question, guys, right? So partial seizures or complex seizures, this is some terminology. You know, seizure doctors, we spend way too much time on terminology, but it's important to know, does your doctor or your provider think your seizure is coming from like one area of the brain, multiple areas of the brain, or generalized throughout the brain? This has been studied in all individuals, so of all different kinds of seizure types. And if you have drug-resistant epilepsy, which just means 2 medicines didn't get the job done, then yes, it is approved for that, or it is helpful for that. The actual FDA approval is for people who have the partial seizures. But I, off-label and of my own practice, have used it frequently for individuals who have seizures that come from multiple parts of the brain or the generalized seizures, and I have found that it works extraordinarily well. Again, the official FDA approval is for partial seizures, those focal seizures. So absolutely, it's useful for that. Now, I have a very good question that says, is VNS therapy only for intractable epilepsy? And the answer to that is yes. So again, that's 1 out of 3 people with epilepsy have drug-resistant epilepsy, or as our participants said, intractable epilepsy. The second most common outcome in epilepsy, meaning 2 medicines didn't get the job done. So if you are on a 3rd medicine and you're only having seizures once a year, that still counts as being intractable epilepsy. And none of the devices, vagus stimulator, or later today you're going to hear about other surgical options like the RNS, which is an implant in the skull, or the DBS, which is a brain surgery with an implant in the chest. None of those are FDA approved for anything other than medically intractable epilepsy, which again, is 1 out of 3 people with epilepsy. Okay, and so I think we were flying through those questions pretty quickly. I'm going to wait here just to see if there's any more questions that come up. I think a commonly asked question in my clinic is that, you know, say somebody has seizures, you know, well, first of all, there's no seizure frequency that makes somebody a candidate for the nerve stimulator. But sometimes people will say, well, I only have a seizure every 1 to 2 months. So I don't think that, you know, my seizures are bad enough to get this device. Well, that's keeping people from driving, and leaving seizures when you have drug-resistant epilepsy and you're still having seizures every 1 to 2 months, and leaving seizures untreated and not doing anything outside of medicine eventually could make the seizures worse over time. So it's a really important thing to be proactive like you are today and learn more about options outside of medicines. And the vagus nerve stimulator is incredibly good for. And again, I'm going to wait here just for a few more minutes just to see if there's any other questions. You guys can ask me anything. And then we'll let you get on to your next session. And I just want to tell you, thank you so much for being incredible. Thank you to Disneyland and to Dr. Holder and to Brad and to everybody who organizes this day, because what I was talking about at the beginning, where we don't know or talk enough about epilepsy, things like today, events like today are changing that. So I cannot speak. This is what I've decided to do as a doctor with my career, is work with individuals. Having advocacy like you're doing today and being part of the Epilepsy Awareness Day at Disneyland, I applaud all of you. You guys are the best. Let's see here. I have a question about have I seen it for sensory simple partial seizures? So that means that this person has seizures that are coming from partial, meaning like focal, coming from a part of the brain, and it's causing sensation symptoms, and simple meaning they're not losing consciousness or awareness. And the answer is absolutely. I have a young woman where it was simple motor seizures, but it's working. Somebody who is very, very afraid of about and seizures. We know that can cause vomiting after a seizure. And now with the magnet, it gives her that control because she's very afraid of the after effects of her seizures. And I am so happy to report she is doing so much better with this device. So absolutely, I have seen it used for that. And I've seen people have massive control over that, a massive benefit. And like we talked about, one of the biggest improvements is in mood. Because even if you have simple simple focal seizures or sensory seizures, regardless of the kinds of seizures, we know that depression is a common component for epilepsy. And so regardless of your seizure type, we know that depression is something that people frequently suffer when they have epilepsy. And this device is absolutely beneficial for depression. Great questions, you guys. I am so pumped up that you are such great advocates for living your best life with epilepsy. This is going to make me, you guys made my whole week by being here and by asking these outstanding questions. So thank you so much. And for participating in Epilepsy Awareness Day at Disneyland. Nothing's for you. I appreciate everybody. I'm going to sign off now, but I just want to let you know, I think you're all amazing. Stay tuned for the rest of the afternoon. Looks like they have a great agenda for you. And it has been my absolute pleasure to be here with you today. I am just so impressed with all of you. Thank you so much for being here today. And thank you for your questions and for letting me be part of this. I really appreciate all of you. Thank you.